Good afternoon, everyone. I'm coming to you from my office. Most of the time, I'm coming to you from home, but I am a little late as far as posting this, so I wanted to go ahead and get it out of the way now. We are looking at chapters 8 and 9 in regarding blood diseases and diseases of the heart and heart vessels, I believe. Let me check. PowerPoint presentation reviews the diseases of the heart and vessels and the components of blood, I believe, pretty much is chapter 8. So one of the things that you need to make sure that you do, if you haven't looked on Blackboard already, please make sure that you access that heart document, print it off several times. There are, I believe, 25 spaces for you to identify, and you've already had this diagram before because you had it in anatomy. So I would just suggest that you practice that over the next few days because you will see that as part of your quiz. That is a whole separate component of your quiz that you'll have on Thursday, in addition to the questions that you'll be asked from chapters 8 and chapters 8 and 9. So when you are reviewing the information in chapter 8, please make sure that you go back and you review the different components of blood. Remember, we said that blood is composed of the formed elements as well as plasma. The only way you can see that is if you centrifuge it, and which means spin it very rapidly, and then the formed elements settle at the bottom while the plasma rises to the top. And remember, plasma is composed mainly of water. The formed elements, of course, you know the erythrocytes, the leukocytes, as well as the thrombocytes. Make sure that you know their various functions, and from that point, because you may be asked some questions, and when you're looking at the information in regard to the leukocytes, make sure that you can differentiate between the agranulocytes and the granulocytes. So that's my review of that, and also in your textbook, which I have right here, and I believe it's in the appendix section. Yes, appendix C goes over information in regard to blood if you don't have your anatomy textbook handy or you don't have your anatomy notes. And then appendix D goes over information in regard to the heart and blood vessels. So the PowerPoint presentation, and if you see me looking this way, it's because I'm looking at my computer. In the PowerPoint presentation, the introductory information is in regard to the components of blood, so you have access to that information, and it goes right into the different relative changes. So as you're reviewing this presentation, make sure you have your textbook, PowerPoint presentation, any other notes that might assist you in your understanding, as well as I think that's it. I think that's all you would need. Also, make sure that you access the website. I think I have made some links available to you in regard to different heart and blood diseases, I believe. If nothing else, I know I have posted a movie for you to look at. I've gotten a little bit of feedback from some of you in regard to how you've enjoyed that movie. It was wonderful. So make sure you take a look at that in the event there's a question or two on your quiz. I'm just saying. Okay, so if you're looking at the PowerPoint presentation and it goes into the reactive changes, let me try this way a little bit. You probably can't see it, but just so you know, there's the presentation I'm looking at. In your text, it begins with leukocytosis, and we know that any type of cytosis is an increase in the number of something. Here, obviously, it's the increase in the number of leukocytes. Now, under that, and I actually should change the bulleted point that you see here because then it has leukemia. Well, we just referenced leukemia from chapter 7 in neoplasms. Now remember, leukocytosis is just the increase in the number of white blood cells, while leukemia, that we refer to as cancer of the blood, is the abnormal proliferation of white blood cells. Leukocytosis and leukemia are not synonymous, but I think we cleared that up when we were talking about the neoplasms. And then also the bulleted item leukopenia actually shouldn't be under the broader heading of the leukocytosis because leukopenia is just the opposite of that. It's a decrease in the number of white blood cells. And as you read on page 95, it gives you a clear differentiation between the two. Okay, now under the next category, and I'll move to the next slide, is referring to anemia. And it talks about the two different types of anemia. There's primary anemia, and then there's also secondary anemia. Primary anemia is when there's actually no production of the red blood cells, or there's a decrease in the production. So aplastic anemia is there's absolutely no formation of the red blood cells at all, while just general anemia could be as a result of the loss of, not the loss, that's secondary, just a decrease in the production of them. So primary, decrease or no production, while secondary is as a result of some type of destruction or they are lost. For example, secondary anemia can occur as a result of trauma, where you lose a lot of blood, so you're losing a lot of red blood cells. In addition to that, I believe your textbook refers to hemolytic anemia, in which hemolysis occurs and there's a loss of red blood cells there, and also pernicious anemia. And if you look at the top of page 96, it refers to the lack of the absorption of vitamin B12. Now, obviously, that could be as a result of poor diet, the intrinsic factor that allows the B12 to be absorbed through the small intestine. That would be an example of pernicious anemia. And then finally, sickle cell anemia. And I think that is also in the PowerPoint presentation, yes, under secondary anemia. Now, the problem, and I think I've talked about this before, or in one particular class, we talked about the fact that there are certain types of conditions that are considered genetic, or they are sex-linked genetic. I think we talked about it in regard to color blindness and something else. Hemophilia, that's another one that we talked about it with. With sickle cell anemia, and I'm just going to draw something very quickly. Let me see if I can find something wrong. Just get some paper. I think I've shown you this before, and if I haven't, bear with me, but I want you to understand the concept of sickle cell anemia, because one can be a carrier of the trait but not actually have the disease. Sickle cell anemia is one of those conditions that is considered a recessive trait disease because it's carried out by the recessive genes. Now, if you're trying to understand what I'm saying, the genes are what you get from each parent. It's what makes you you and what makes me me. So, if I have sickle cell anemia, genetically, hopefully you can see this, genetically, these would be the genotypes, the genes that are given from each parent. So one parent will give you, excuse me, something came up on my computer. Just a second, something else came up. Completely lost what I was doing. Okay, there we go. So one trait is passed on by each parent. These would be considered the dominant traits. Dominant traits are typified by a capital letter, while the recessive traits are typified by small letters or lowercase letters. In the event of sickle cell anemia, where one parent is a carrier of the trait and the other parent is also a carrier of the trait, if you can think of this as like the multiplication table box where you're trying to learn how to do your times tables, that's exactly what this is. It's called a Punnett square. Ideally, what would happen, the chances of the offspring developing sickle cell anemia would be a 25% chance, because here the dominant traits, which means what would be expressed in the individual, the dominant traits would mask the recessive traits. So here, this dominant trait would hide the sickle cell anemia. However, this person would be identified as a carrier of the trait. Same here. But notice here, the two lowercase s's indicate that the person actually exhibits the disease, sickle cell anemia. So make sure you read that information, because as we continue on through the semester, there are a couple of other genetic diseases that we'll discuss, and those are the same types of ways that you can determine whether or not the person would actually exhibit the disease, or would they just be a carrier of the trait. Okay, continuing on, under the other disorders, once again, leukemia comes up again. But the next one is polycythemia vera. Polycythemia vera is also referred to as erythrocytosis. And once again, cytosis is indicating the increase of something. Here we have an increase in the number of red blood cells that are present. The concern with this particular type of disease is the fact that it can increase clotting, because the blood becomes more viscous. Viscosity is referring to the thickness of a fluid, and in this case we're talking about the blood. So in the event that the blood is more viscous, it may be more prone to clotting. Therefore, it may be necessary to use an anticoagulant to keep the blood from clotting more severely. And that's postmortem. Don't do that antemortem. Okay, continuing on. Bleeding disorders, and I believe there was someone in the class that actually did this one as their blood disorder for the case study from last week, which is hemophilia. Hemophilia is another genetically hereditary sex-linked disease, and I think there's actually a link. Yes, there's a link in the PowerPoint presentation, and it's sometimes referred to as the bleeder's disease, because in this particular type of disorder, the person who has it actually has fewer thrombocytes than necessary to interfere with that would interfere or that would accelerate the clotting. So therefore, they don't have it. And so a cut or minor bruising can lead to severe bleeding. In addition to that, then you see the next one is thrombocytopenia. You just don't have enough. Penia means a reduction in the number of, and it's just a severely reduced platelet count. Not like hemophilia, because that's actually genetically linked. The case of thrombocytopenia, it's not a genetic disorder that occurs. Following thrombocytopenia, and under thrombocytopenia, it does go into some of the information that you also need to know in regard to purpura, which is associated with thrombocytopenia, and it's an increase in the number, it's a decrease in the number of white blood thrombocytes, which can lead to discolorations very easily, a lot of bruising, and as you notice in that last paragraph, the last sentence, in the deceased, the discolorations due to purpura are permanent and extravascular, which means it cannot be flushed through your arterial injection. Now, what's not in the PowerPoint presentation that you will need to make sure that you read about is hemolytic disease of the newborn. It was at one point referred to as erythroblastosis fetalis, and it's a very interesting concept that you'll need to understand, because it actually deals with the mother potentially rejecting the fetus, a fetus. Not the first child that she's pregnant with, but the second, because our bodies will build up antibodies against anything that it refers to as foreign. So when the mother is actually pregnant with the first child, if the mother is Rh negative, and the father is Rh negative, then the mother will build up antibodies against that. But when she is pregnant with the next child, the body recognizes it once again as being something foreign, and will actually reject the fetus for the second pregnancy. Okay, moving on to the heart and blood vessels. Let me see. The PowerPoint presentation goes into the various predisposing factors: heredity, obesity, diabetes, elevated cholesterol levels, smoking, social factors, which refers to the various substance abuses, and not just drugs, but alcoholism can contribute, diet, stress. These are the various types of predisposing factors for the various problems of the heart that comes after that. You will notice it goes right into hypertrophy of the heart, and we know that's just an increase in the size of the heart muscle. And we also talked about hypertrophy. Remember in anatomy we talked about the left ventricle being the hardest working chamber of the heart because it's responsible for systemic circulation. This is the hypertrophy that we're talking about. The heart muscle in general can hypertrophy, but particularly that left chamber, the left ventricle of the heart, because it has that awesome responsibility of pumping all of that oxygenated blood throughout the rest of the vascular system up through the arch of the aorta, and then the aorta then branches off into the several regions of it, the ascending arch, descending thoracic, abdominal, and then finally goes down to the legs. So hypertrophy can be referring to not only the left ventricle but the entire heart muscle itself. Dilation due to the stretching of the muscle fibers that can occur. We also talked about the different valvular conditions that could occur. Here we're referring to endocarditis. Obviously, that's the inflammation of the inner lining of the heart. Make sure you know those layers of the heart. That could be a question that you would need to know. The different types of valvular defects. We've got valvular insufficiency, where the valves themselves don't close completely, and when they don't close completely, they allow for the mixing or the backflow of the blood either into the left ventricle or in the right ventricle because it doesn't close completely, so blood can spill through. Valvular stenosis, same thing can kind of happen. The flaps or the cusp, remember we have the tricuspid side valves that's on the right side of the heart, and then the bicuspid or the mitral valve that's on the left side of the heart. These heart valves can actually become stenoic, meaning they harden. When they harden, it makes it difficult for them to open and close completely. Thus, the insufficiency could occur. And then finally, valvular prolapse is when the valves have become weakened and they kind of flap back and forth like restaurant doors. If you want a restaurant, you can just push the doors open. And the valves are ideally supposed to open in unidirectional and then close tightly. Okay, other heart conditions that you need to be concerned about: pericarditis. Remember, we've got those three layers of the heart, and then the entire heart muscle itself is surrounded by visceral pericardium. That pericardium itself can become inflamed. The myocardium of the heart can also become inflamed. And then also we have rheumatic heart disease. I think I may have said something about this before, maybe not. I might be thinking about another semester. However, when you view that video, it's very important, and I know we all do this. You start feeling a little bad, you have some strep throat, they give you the antibiotic, and you take it for a couple of days, even though they tell you to take it all. But after a few days or so, you stop taking the medication. Well, in the case of strep throat, it's really very important to make sure that you take all of the antibiotic, because that particular microorganism can lie dormant in your system and come back several years later as rheumatic heart disease. And in addition to that, scar tissue develops inside of the heart muscle, and it's referred to as Aschhoff's bodies. And so that strep throat that you had that one time that you ended up not taking all the medication for could potentially come back as even a more deadly disease. I actually had a student a few semesters ago. It was more than a few semesters ago, but that's actually what happened to her brother. And it all started when he was younger and developed strep throat, and then came back. And she actually said he succumbed to rheumatic heart disease as a result. Okay, so now we've got our coronary artery disease. And remember, it's the coronary artery that feeds the myometrium with its own blood supply. Remember, the heart doesn't rely on the regular blood supply that the rest of the body does. It doesn't rely on pulmonary circulation. It doesn't rely on the systemic circuit. It actually has its own coronary arteries that supply the heart muscle with blood. However, those vessels, just like any other vessels, can become sclerotic. And you'll notice the first one is referred to as atherosclerosis. It's hardening of the arteries as a result of the deposition of plaque. That's atherosclerosis. Now, there is arteriosclerosis. Arteriosclerosis is the hardening of the arteries. It might not necessarily be as a result of the deposition of plaque, but there's still the arteries hardening at any rate. But atherosclerosis is specific to the deposition of plaque. And so then what is plaque inside of those vessels? All that macaroni and cheese. I'm guilty of it too because I like macaroni and cheese. Fried chicken or just the fried foods, lack of exercise, all of that contributes to the buildup of cholesterol inside of the body. And the cholesterol is dense. Therefore, it deposits inside of the vessels. And we talked about one other time before the fact that the vessels can become occluded, especially if they have, let me just give you an example, draw it for you. Okay, so that's the vessel. And so after all that good eating and lack of exercise, because you know after you finish eating all you want to do is sleep. So then all this cholesterol begins to build up in the vascular system. And so now we've got this. So even though the vessel is not completely occluded, the blood still has to kind of make its way through the vessel. And if we continue with that type of lifestyle, then eventually at some point, it may become so occluded that the blood can no longer continue to flow. Okay. In addition to those diseases, it talks about thrombosis, spasms, and embolism. I believe we referred to those when we were looking at disturbances in circulation, which was back in chapter 6, so you might want to refer to those notes in regard to what thrombi are, emboli, so on and so forth. Those should be pretty simple for you to remember. Just make sure you can differentiate between which one is stationary and clot and which one is a free-flowing particle, and the different types of emboli and thrombi that can occur. Continuing on with the problems of the heart, this information is really very easy to understand and easy to read in the text, so make sure you review that information. We've also already identified what myocardial infarction is. Go back and review the terms ischemia and hypoxia and infarct. I mean, obviously a myocardial infarction means it's a heart attack, but review what an infarct is. The infarct is where the tissue is actually becoming necrotic. Hypertensive heart disease, which is just high blood pressure. Cardiomyopathy is just the general overall deterioration of the heart. And carditis is the general inflammation of the heart muscle itself. So, as you are reviewing the information, the last slide that talks about the blood vessels, I believe I've touched on all of them. Aneurysm. A lot of times when we think of an aneurysm, we think that the vessel actually has to rupture. That is a type of aneurysm. However, aneurysm can also be the bulging of that vessel. So a person can actually be walking around with an aneurysm because the vessel, and I'll just show you, if this were the vessel, you'll notice that there's a slight bulge right here, but over a period of time, as the pressure continues to build in that vessel, then it can begin to bulge even further to the point that it could actually rupture. Phlebitis, inflammation of the vein, and varicose veins or varices are just the rupturing of very small vessels within the vascular system. There was something else that I was getting ready to say, and I just kind of lost my thought. Give me just a minute. I think it'll come back. Because I was talking about, aneurysms. Make sure, and I'm not certain if the text goes over what a transient ischemic attack is, TIA. But transient ischemic attacks are what we refer to as mini strokes, so to speak. And CVAs are cerebrovascular accidents. So I believe it touches on those in the chapter. If not, I will provide information and additional links for you to be able to review those two terms more. Okay, well, I believe that should do it. I do apologize for the delay. Everything just kind of got out of whack with the weather, and but I did want to make sure that I at least got that posted for today. If you have any additional questions or concerns, please make sure you submit them to me as soon as possible. You can send me an email, or you can try to catch me during the office hours. Thank you very much. See you soon.